I'm Derweesh. I'm a urologic oncologist. I'm a professor of urology and radiology at the University of California, San Diego School of Medicine, and I'm the program director of the Urologic Oncology Fellowship. I was just diagnosed with renal cell carcinoma. Why did I get this? Is really the key question that patients ask when they are referred to a urologist or a medical oncologist that they're seeing for the first time. It's actually a profound existential question in terms of why me? Certainly what we have is we've learned a lot about carcinogenesis, the development of how a cancer or how a normal tissue develops and accumulates certain types of mutations and develops into different types of cancers or different types of kidney cancers. We also know a lot about some of the risk factors that can be driving this. For example, in kidney cancer, this is a tumor that is growing at approximately an incidence rate of about 2 to 3% per year, and it's being driven not just by tobacco consumption, and that was the classical risk factor, but also by the epidemic of obesity, of high blood pressure, of certain toxic chemical exposures. But the main risk factors being, from a demographic standpoint, male, high blood pressure and obesity and tobacco use are from a populational standpoint. Approximately 10% of patients who present with kidney tumors have familial syndromes. So patients who are presenting with tumors in their second to fourth decade of life, and oftentimes with tumors on both kidneys, should be strongly considered for extra testing, genetic testing, because this may be associated with a familial syndrome. Patients who are presenting with a family history of kidney cancer also should be considered for that. So that's what we do know. What the gap in our knowledge is how does a specific risk factor lead to a certain sequence of events in one patient who may be at risk to then develop a cancer, but in another patient with similar risk factors not to develop the cancer. Kidney cancer afflicts about 75,000 men and women in the United States per year. So these risk factors are populational and can be even much more common than the actual incidence of kidney cancer itself.